Hi everyone, welcome to Tuesday's session. I'm glad to see all of you here. So let me share my screen. So I'll share the agenda. Professor Miriam, are you going to lead the meeting?
No, I'm happy for you to do that, Aliyah, but I just wanted to introduce Professor Bisiande. As you see, he's attending today, and he'll be here for a short moment now, and then again longer for next week. And Professor Bisiande is professor at Luxembourg University in computer science. He's an expert on security, network security issues, but also on blockchain. And I've known Professor for a long time. He's also actually a good friend of Dr. Gretjan van Stam from Zimbabwe. And over the summer, we were working together because he gave us a big hand for the NIH proposal. And so one of the countries that was introduced for the expansion of the network was Burkina Faso, where Professor Bisiande is opening a lab together with universities there. And we also even received a letter of support from the Ministry of ICT. So Tegawendo, it's a real pleasure to see you here. I know you have another meeting, but I didn't want to miss this opportunity to introduce you here to the whole team, including to Professor Francesca, who is the executive coordinator from VODAN Africa. Please take the floor.
Thank you very much. I did not want to disturb the meeting by my presence, but yeah, I always wanted to come to the meetings, but you know, something always, always comes up, and like right now, but I will make sure to be there next Tuesday. Yes, thank you very much, and thank you for all the great work that you are doing all together for Africa and Asia. Thank you very much.
Thank you. You want to add something for Francesca, please do.
Oh, yeah.
Professor Francesca?
Yes, Prof. Sorry, I have a conflict in meeting, so I had to leave that venue to come out. Yes. I would like to welcome you very specially, Professor Bisiande, and thank you for the help on the on the NIH call and for all the other help on the project. We're happy to have you, and this is our family. I would also like to announce that we're expecting the representative of the Federal Minister of Health from Nigeria to join us. Aliyah, can you mute Williams, please? Yes, thank you, Aliyah. Yes, Prof, I'll hand over back to you now. I was just announcing that we're expecting somebody from the Federal Ministry of Health from Nigeria to also join the meeting. So as soon as the person is in, I will let you know so you can also, we do the introduction as well. Thank you.
Thank you very much, Francesca. Thank you, Professor Bisiande. And then we'll go back over to you, Aliyah, and we will agree that Francesca will break in the meeting when the Ministry of Health from Nigeria joins the meeting. Thank you.
Thank you very much. Welcome again, Professor Bisiande. Glad to see you here. So I hope that we'll see each other in further meetings. So with that, I would like to share the screen. Yeah, so, yeah, sorry, this one is, yeah. Basically, so today we're going to discuss, firstly, update of the health facilities communication by PUTU. And then, so we are having a good progress on CEDAR deployment part. I think that some of you already seen the chats in WhatsApp that the progress number we did today. So Oljas will share the updates later on. And then we're going to discuss the templates and vocabularies, and also advanced training that was given by John last week. Some inputs we are expecting from Nurullah and Mariam regarding the input into DHIS, and then data steward certification. Then we're going to discuss updates on dashboards by Yilin, who is going to lead the team on dashboards. And then updates of the country coordinators meeting and country updates by all country coordinators, and then special issue updates and questions and answers if there are some. So with that, I would like to give the floor to Putu. Putu?
Yeah. Thanks, Alia. Wait a minute, I will share my screen. So I will update about health facilities communication report from access and control. So yesterday we have every Monday we have a discussion about the progress of communication. So from Nigeria, we're finished with all round of communication for all of the health facilities, but there is a progress an issue, because I cannot find the file from these three health facilities. It is IBB Niger State, Kacha, and also General Hospital Mina. And I'm finished with the evaluation of the answer, and Abdullahi should check some field that is still unclear, and also blank field. So I create the red field for the blank and the yellow field for unclear statement. And from Uganda, we are finished with these three health facilities. It is Case Clinic, KIU, and ARC Specialist Hospital. And
if you can go back to the slide 5, this is not complete because we have added Lira Hospital, Lira Referral Hospital, and so that information has not come through. Maybe Mariam can fill in. And no, Lira is L-I-R-A. And then also Hoima Hospital from Hoima Referral Hospital from Western Uganda. Hoima, H-O-I-M-A. Mariam, can you? I'm sure you'll be picking up this as a country coordinator, Mariam.
Yes. It all had been, I don't know, maybe I didn't communicate well with Putu. Although with Hoima, I'm still not yet in touch with the data management personnel from Hoima. So I'm still...
That is not a problem, Mariam, because it's very recent Hoima Hospital that it has joined. So, but I just wanted to make sure that the file is complete. And the correct, and the correct spelling, Putu, is in the chat. So you can then follow it up with Mariam and the team. Thank you.
Okay, thanks, Professor Miriam. Maybe Mariam forgot to tell me about that, but I will update the list in the Excel sheet and also in this progress update. And for Uganda, so I'm finishing the final report of Case Clinic, and I will share it, the format of the report in the end of this slide. And from Kenya, Kenya finished with Kenya Medical Research Institute. This health facilities finished all round of questions, but still waiting from Zambezi and Beacon of Hope Hospital. And Professor Dr. Reginald told me about the progress for with the Nairobi City County Ministry of Health, and they are asking for like something like workshop about VODAN Africa. And tomorrow Alia, Mariam, and I, and also Dr. Reginald will discuss about this. What can we do about the workshop about to introduce VODAN to them? There are 20 data steward. Maybe Dr. Reginald can explain in the country coordinator progress. And from Ethiopia, I'm finished with they are finished with the all round of communication, and I check all of the answer. There is no problem from the answer, and I'm ready to create the report from Ethiopia. So expecting a report draft this week for all of for the health facilities. And from Somalia, also finished with all round of communication. And right now I'm discussed with Din Jamal about unclear answer from dashboard internal question. And Din Jamal also got a draft about the agreement, but it's for the health facilities, and Din Jamal right now is still editing the draft for make it fit with the agreement for the Ministry of Health. And I finalized the report for public and private health facilities in Somalia. But from Zimbabwe, so still no like progress for the round of question. Maybe Kuda or Professor Bernard can update about this on the country coordinator update. And from Tanzania, I'm finished with all round of questions. So I interview Dr. Jeremia, and I'm making the script of the Tanzania interview with Dr. Jeremia. So now there are two reports that I created right now. It is about the dashboard and facility report. For example, like the case clinic, I made the report with the PPT form like this. So it is quite like a brief description about the for each health facilities. And there is another report about dashboard, but I discussed with Lynn yesterday. Lynn said that it is better to show the prototype of dashboard to health facilities and get the feedback from them. So yeah, that's all from my update, and I'm still waiting for the discussion of the dashboard, because I can help for the dashboard based on the finding on the communication topic list question. So that's all, Alia, from me.
Thanks a lot, Putu, for this wonderful update. So we'll move to the next point. So on the CEDAR deployment and testing. So Oljas, please take the floor.
Hello everyone. Yeah, thank you for joining this meeting about the CEDAR development progress. Actually, we this week we are able to install it locally on Ubuntu OS, like natively, and successfully run all the service. We get to the point that we have like internet limitations. I think after the handling this problem, the team going to check the querying process between the team, within the team. Like, for example, Nambobi made his the CEDAR point, and the other team from Nigeria going to check the connection. How does it work? I believe this week we'll be able to get this, achieve this. Yeah, we will achieve this thing. And the next thing that about the CEDAR installation, technical documentations are coming. It will be on Friday regarding how to install it. But at the same time, we have like a virtual image of Ubuntu OS. Also, we have bootable device that can be also shared publicly. I think after we solve the problem with internet like limitation. But then I think, yeah, we will see after that. Maybe we can make it after making the publicly available, try to scale it and install other devices as well. Yeah. This is all from my side.
Thank you very much, Olras, for the update. So we'll proceed to the next point. It's templates and vocabularies. So let me share the screen. So basically, these are all the templates that are now belongs to VODAN. And the green ones are completed, and they already received review from John. They have been reviewed by John, and even when we were able to work on the given comments by John, and some of the templates are ready, and some templates are still in progress and being reviewed by country coordinators, and we are expecting to be finalized this week. So basically, all OPDs are ready except Zimbabwe and Liberia. And then, yeah, so, and then maternal and child health, Ethiopia is ready. Vocabularies have been published to Bioportal, and we have resolved the issues regarding the vocabularies. So, and then William has started creating ANC template for Kenya, and he sent me the original medical form, and he is now currently working at creating this template for Kenya. So yeah, so and we have the other template, which is cause of death for Tanzania. It's ready and published, and also has been reviewed by John and me, and already has like it's ready basically to further work. I mean, like by the users or healthcare facilities actually. These are all the vocabularies that exist in Bioportal. So these are links in Bioportal. And then these are the Excel Excel sheets. So you can also, for instance, you can download them from GitHub and see the original files. So
yeah. Would it be a good moment to welcome the Ministry of Health from Abuja, because they have arrived?
Yes, sure.
Sorry to interrupt.
I'll unshare my screen.
Professor Francesca or Professor Sakinat, do you want to welcome and introduce your colleagues from the ministry?
Yes, Prof. I would like to invite Dr. Abdullahi Ibrahim to introduce the delegation from the Federal Ministry of Health, Abuja, Nigeria.
Yeah, thank you so much, Prof. Miriam and Prof. Francisca. Yeah, we have a representative of the Federal Ministry of Health, a person of Eberichi. This is a person representing the head HMIS of the whole country. And he's going to take the follow-up from this meeting up to the minister's office. And he's also going to be part of this meeting throughout so that we can see and understand what we have been doing. Thank you so much.
Congratulations on that really important meeting that you had, Prof, and also welcome to the representative. And perhaps you would also like to take the floor to greet the meeting.
Yeah, please, Eberichi, you can now greet the whole team, please.
So I think I can proceed then.
Yeah, hello, good afternoon.
Good afternoon.
Yeah, I'm so sorry I came in late. I really appreciate your efforts in the health sector. So ably representing Mr. Ali Aguai. So the feedback for this meeting will be taken down to the ministry. Thank you very much.
Thank you very much. Alia, before we proceed, let me ask Professor Francesca to introduce some of the country coordinator leadership to the colleague.
Yeah, sure.
Thank you, Professor Miriam. And I would like to add my voice to all the welcome messages to Mr. Iberici from the Federal Ministry of Health, Nigeria. The VODAN Africa is an initiative of different countries and ministries of health and hospitals in Africa, where across the different regions of Africa. So I'm going to start from the east of Africa, where we started from. And in the meeting, we have Miriam Basaja, who is leading the team in Uganda, together with myself. Miriam, if you like to just turn on your camera or just say hello, so that Mr. Iberici will get to meet you.
Mariam
Basaja. Yes, that's Mariam from Uganda. And still in East of Africa, we have Dr. Reginald Nalugala, who is the country coordinator for Kenya. Dr. Reginald also coordinates all the country coordinators from the program. Dr. Reginald, maybe you'd like to just turn your camera and then wave and say hello to our guests.
Yeah, welcome from Kenya. Welcome to VODAN Africa. Thank you.
Thank you, Dr. Reginald. I'm trying to see if we have Dr. Wondimu. Dr. Wondimu is from Ethiopia. He coordinates the program in Ethiopia. But in the absence of Dr. Wondimu, whom I don't see on the call, I would like to invite Ephraim. Ephraim also gives updates about Ethiopia, so he kind of assists Dr. Wondimu in the administration of that country. Ephraim, would you like to just say hello and welcome our guest? In coming to the south of Africa, we have Zimbabwe. Zimbabwe is led by Professor Bernard, who is attending the Senate meeting with Kudakwashe. So we have Zimbabwe is not here, but we'd like to welcome, on behalf of Zimbabwe, to welcome our guest from the Federal Ministry of Health of Nigeria. And then coming from the south of Africa, let us go up north to Tunisia. Tunisia is coordinated by Professor Mariam from the University of Sousse. If Professor Mariam is on the call, perhaps we should just say hello. I don't see her on the call. Okay. Then we come to the west of Africa and your home, Mr. Iberici. We have Nigeria coordinated by Dr. Sakinat and Dr. Abdullahi. Dr. Sakinat, would you like to say welcome to, of course, to your countryman? Dr. Sakinat?
Hello, Mr. Iberici. We welcome you. We'll see more of you behind the camera.
Thank you, Dr. Sakinat. Dr. Abdullahi, which you already met, who coordinates Nigeria with Dr. Sakinat. So we have the two powerful people who have been doing great things in that country. And of course, in Burkina Faso, I'm trying to see if a professor is still on the line. I think maybe he probably dropped off. He was with us earlier. But of course, we have the members in Burkina Faso who are also contributing to this. In addition to that, in East of Africa, we have Tanzania being coordinated by Dr. Jeremiah. And of course, there is Liberian, where we have Dr. Kebede. So that is our growing network in Africa, and we're hoping to expand further with the support of sponsors and partners in the Federal Ministries of Health. Thank you, Professor Miriam.
Yes, and normally we also have Dr. Jamal here from Somalia.
From Somalia, yes, Dr. Jamal from Somalia. My apologies, please. I was going through the participant list. We have Dr. Jamal from Somalia, who coordinates the Somalia and one of the very vibrant networks. And of course, we have the PhD students who provide technical support from Leiden University. Aliyah, who is coordinating this meeting. We have Putu, who had given his updates earlier. There is Nurula, Rudwan, and we have Misha and several other people. And of course, all is our technical lead. And we have the data stewards from the different countries. They're all on the call. And our global coordinator is Professor Miriam Van Rijzen, the professor at Leiden University Medical Center, professor of data science. Of course, she has been coordinating the meeting. You already seen her. Professor Miriam, perhaps we also like to welcome our guests before Aliyah continues.
Well, thank you, Dr. Francesca, for these introductions. And again, to Professor Abdullahi for bringing the guests here. And it's really a pleasure. I hope that the meeting is not too inaccessible, because I think we have developed a lot of words to quickly take ourselves through the agenda, but I could certainly invite you, sir, to feel free to raise any questions for clarifications. We are honored that you are here, and we should really like to welcome you as a guest, and not to feel shy to ask any questions for clarifications as we go through the meeting, as that would help you to get a clearer idea of what we are trying to achieve here. So with that, let me ask one more time whether you would like to take the floor before I hand back over to the chair of today, Aliyah, for the continuation of the meeting, sir.
This is Professor Miriam. I would like to also inform Beth just joined the meeting that we have the representative from the Federal Ministry of Health in Nigeria who is joining us today. So Beth is from the GoCare Foundation, which is one of our technical partners on the project. GoCare is a European organization, and Beth is representing GoCare. So welcome, Beth.
Would you like to respond? No, Beth, I was directing to the Ministry of Health of Federal Ministry of Health of Nigeria. I was giving them the floor. Sorry, Beth. Nice to see you.
Yeah, that's fine. I understood that.
All right, then Aliyah, I'm handing back to you to continue the meeting, and please feel free to share the screen and take over from where you were.
Thank you very much. So basically, I finished an update regarding vocabularies. Yeah, just one thing to mention, that last week we were able to receive an advanced training on vocabularies, and I already sent the recordings of the trainings. So it was lasting for 2 days, and now if you want, you can watch the recordings and find very interesting and useful information regarding vocabularies. So with that, I would like to give the floor to Nurula or Mariam regarding the input to DHIS or HMIS platform. So please, Nurula, if he's on the call. Yeah.
Hello, Leah, and hello,
Hi.
everyone. Hi. Now, the template and the vocabulary is almost finished for the Uganda. We start with the Ugandan template. Now we are working on the software right now, and yesterday we had a discussion with Mariam, and we had discussed about the program requirements, about should we deploy as an online server or locally. From this stage, we will working on the software. This is it from my side. If anything else to add from the Mariam, please.
Mariam Basaja, do you want to add a bit to the feedback of Nurullah on the work of the input of the data in DHIS?
Yes. I think Nurullah has basically covered everything. So we basically covered the training for him for the CEDAR system, understanding the whole system, how it works, template creation, vocabulary creation, and now he's starting to look into the APIs for both the CEDAR system and the DHIS too. And then we'll move forward from that point.
Thank you.
Thank you very much. And then we're going to move on data steward certification. So basically, I can tell that objectives and requirements will be developed and presented later, maybe in coming weeks. So everyone can see the requirements and objectives on the data steward certification. And then, as we discussed it together with Professor Miriam, we'll provide also the links to fair data management models developed under NOFIG project. Yeah. So everyone in the community can watch and also learn things related to vocabularies and templates, and also fair data point and fair data management. So how we can proceed with the further work in terms of fair implementation. So basically this is it on the data steward certification. So then the next point is the dashboards. So Yelin is going to lead dashboards team, right, Prof? Okay, so Yelin is going to give us the presentation next week on his work that he was able to do. I don't know if Yelin, would you like to speak to that now?
Sure, Alia, thank you. About the updates of the dashboard, I could report for the team of front end, because the dashboard team is currently divided into the front end team and the back end team, which is led by Rudwan. About that part of details, I'm not really familiar. However, about the front end part, currently there are a few updates. So firstly, thanks to the participation and the cooperation of every country coordinators and all the colleagues, by updating the information of all the related facilities, I have updated the map for all the facilities with the correct information, such as geolocation and contact, email and address, and so on. And the newly updated map is used in one of the presentations, such as the WHO presentation. And then I will be presenting the further changes of the dashboard next Tuesday, as well as some concerns about the future development. And I think this is the end of my update today. Thank you.
And maybe I can add something, Alia, on the front and back end discussion. So Yelin is managing the dashboard team, and he is working on the front end. And on the back end, Rudwan is working, and as Oisa said, he's presenting on Friday the write-up of the system. And that will tie in then with a test of the backend at the CEDAR platform in a centralized way in with some data, and then also, as Ozars was saying, in the testing in the localized deployments, again to run a query across the locally deployed. So that will be the next phase from Friday onwards. So we are basically working from two ends. The internal CEDAR system, testing the system as such, then testing it in a locally deployed setup where the data are saved locally within the health facility, and then the visualization of that. And that's the work with Jeline, which then ties in with the work of Putu and the entire team to then have the discussions with one country coordinators, representatives of ministries or bureaus of health, and then of course the representatives of the health facilities to tailor make them to each situation. So I hope that is clear, and that this also clarifies why there was a little confusion about the leadership. Jeline and I will be discussing the kind of the pragmatic leadership of that team. But in terms of the content, we are working across 4 technical teams to go to that process of visualization that Jeline will lead. I hope that this is clear for everybody, also for Putu, because Putu, this will also be tying back into your work after the presentation of Jeline next week, and it has taken us a little time to clarify the responsibilities across those 4 teams.
Thank you, Prof, for clarification. Yeah, this is good for us to know who is doing what, and also who is working on backend and front end. Thanks a lot. So I think we can proceed then. Updates of the country coordinators meeting. So I think Dr. Reginald will give an update on that.
Yeah, Aliyah, I wouldn't say much because we plan to meet in 2 weeks' time. But as we reported last week, we were able to finalize the proposal. And as we said last week, we thank Professor Miriam, Professor Francisca, and the team for working so hard to reach this level. So after next week, for sure, we'll have some issues, some points to share with you. For now, maybe I'll just say something about the country report from Kenya. Is that okay, Leah?
Yes, sure.
Yes, I would say that we're still working with 4 health facilities. That is Beacon of Hope, Zambezi, and Kemri. And then in the last 2 weeks, we have had the Nairobi Metropolitan Ministry of Health team joining us, and they have come out in large numbers. So we want to do some kind of induction courses to reach the level where some of us are, or to understand what VODAN of Africa is all about. So the director of Ministry of Health Nairobi County has delegated 3 members to be joining our meeting. There is Alice Kimani, Kevin, and David. And on call now we have Kevin, who is the ICT manager with the Ministry of Health Nairobi. I would just like to ask him to introduce himself and greet us. Kelvin?
Hello?
Hello.
Sorry, I'm on the road. That's why I was a bit distracted.
Yeah, just introduce yourself to us. Yes.
Yeah, thank you, Reginald. My name is Kelvin Kongo. I represent Nairobi County. I work as the head of ICT, and happy to join you guys. I'm basically looking at learning how we can try and integrate interoperability as one of the main challenges we have in Nairobi County. That is the link between EMR systems and other EMR systems, as well as the DHIS2 and the EMR systems. So basically, that's my main concern as far as that is concerned, this conversation is concerned. So I look forward to having a fruitful conversation with you guys. And you're welcome to visit Kenya and see whether we can also have a, groundbreaking approach to these one-on-one. So thank you very much. Looking to have a fruitful discussion later on.
Thank you very much, Kelvin. And then we have Alice. Alice, would like to say hello?
Thank you, Reginald. Good evening, everyone. My name is Alice Kimani, working for NMS as the head of Health Information Systems. And I'm glad and happy to join Vodafone Asia and Africa. We have issues with the data. In most of our facilities, we manage our data manually, but a few facilities that we try to do it electronically, just like Kevin has put it. I'm looking forward to see how we can ensure that these EMRs speak to each other, and also ensure that our systems are interoperable with DHIS. Thank you and welcome, all of you.
Thank you, Alice. And the last one is David. There's a greeting from the director. David, go ahead. David Aluodo.
So sorry to interrupt. David is in 2 meetings, so maybe that's why he's having difficulties juggling both meetings. So yeah.
So thank you very much. And I know that tomorrow, 3 o'clock, we have another consultative meeting. So that is what we can report earlier. Thank you very much.
Thank you very much, Dr. Reginald. So basically, we can move forward, and I would like to see updates from. I would like to hear updates from Wandima.
Aliyah, I don't think. I think some of the country coordinators today are not here as they usually are, but I would like to also report that the discussion tomorrow by the WHO really reflects very, very much the discussions that we have had here, and also within the context of the discussions with the different administrations, like the discussion with NMS that I was able to attend with Alice and Kelvin, reflected very, very much the key consultation of tomorrow by WHO, where we are presenting VODAN Africa and the issue of the EMR systems and interoperability with other systems, health information systems, such as, for instance, DHIS2. They are very, very interested also at that level in what VODAN Africa is doing. I'll put the presentation that draws on all of the different slides that you guys have been preparing in the previous weeks. So, and perhaps we can also share this with our colleagues because it is an open consultation. So also the colleagues from Ministry of Health Nigeria and NMS Nairobi, still possible to attend that meeting. So I think for the country coordinators, we should just hear from Dr. Sakinat and Dr. Abdullahi today, Aliyah.
Yes, sure. So then Dr. Sakinat and Abdullahi. Dr. Sakinat?
Yeah, please, sorry, Aliyah, can you come again? I missed out what you were asking for.
So updates on the country, updates from the country coordinators.
Okay, yeah, just as we mentioned the last time, from our own ends, we have finalized all of the tasks assigned to us. and just as Putu mentioned, and very good. Now we saw the observation he raised, and the technical lead, which is Dr. Abdullahi Kau, will look into the matter, and we're going to resolve as soon as possible. Then moving ahead from the Federal Ministry of Health, we had a very good outing, and I would like to share here. We had a very good outing at the Federal Ministry of Health, the representative of the minister, and we are also supposed to meet them in a good time in this September. So hopefully, and now since we have a representative here, it will give our work a more seamless outing, and it will be very easy for whatever task and the government support the VODAN deem it fit that we will relate back to the FMHO. Thank you.
Thank you, Ibrahim. Thanks a lot. And Dr. Sakinat? Can you hear us, Dr. Sakinat?
It's the same
Yes.
update, I guess.
Yes, Alia, it's the same update with Dr. Abdullahi.
Okay, great. So I think then we can proceed to the next point, update regarding the special issue. So Misha, if you can give us an update on special issue. Misha?
The sound is low. The sound is low. There's a sound problem, I think.
Yeah, it seems like that. His mic is on, but we can't hear him well.
I can step in for this, Alia.
Is this better?
Yeah, this is.
Okay, so the special issue is going very well. I think that we should be able to finish it by the end of September. If all goes well, all except a couple articles have been sent to the reviewers, so a week and a half ago. So they should be back soon. And once they're back, it will all go very fast because in essence, I will consolidate all the feedback and send it directly to the authors or to the lead contact. So that that should then that whole process won't take longer than a couple of weeks, and then we'll send them one last time via Susan, which should all go fast. So I'm expecting the articles to come back by the end of the week, which means that we'll have that we will be able to send something hopefully to Susan by mid-September. And once Susan, it's the end of the road, and then they'll be ready for a publication. So I think we should be done very soon.
Thank you very much, Misha. So I think we have covered all the points that we have planned for today. I would like to ask Professor Miriam to give us a closing speech, if you want, of course.
Yes, of course,
yeah.
Alia. Yeah, that's my pleasure. I would like to ask the guests to say something also after hearing this meeting, and we really welcome your suggestions. To the meeting as a whole, I would like to say that really the process of doing the NIH call was very, very instructive for us. It was very interesting to collaborate with partners in other continents. What I learned from that is that the social the political and the technical problems that we are dealing with here in VODAN Africa, we have them everywhere. We already knew that between Asia and Africa, there were similarities in the problems. But now, for instance, in the context of the NIH, the Stanford University proposed that we included Montana. And the state of Montana has a really huge problem because it's a very low density rural area, which in fact many what you can call remote areas, and also many traditional communities. And so in terms of the coverage or the lack of inclusion in health data was very similar, and also the issues of the need for data ownership as a basis for relating to health data analytics and interoperability. So that was very interesting to learn. And the same is true for Europe. I was having a meeting yesterday with a doctor from Belgium, and today with a person working in ICT for COVID health management in the Netherlands. And all of them are reporting very, very similar problems as what we are solving here, or trying to solve here in VODAN. So that was one thing that I learned. And the other thing that I learned is that there is a lot of interest from other places in the continent. I already mentioned Burkina Faso, but also from South Africa, from Rwanda. There are lots of countries that we were able to solicit interest from. So this is something where the country coordinators meeting will need to consider how we are going to go about that new interest and that further interest in what we are doing here. From the meetings yesterday, we very much emphasized that for this phase, we should make sure that we stay very focused on the testing of the minimal viable product of combining ownership with interoperability, and that even though we have been planning 4 or 5 years from now, we should really be focused on what we need to deliver in October and November. So it was good to be back after that little break. Thank you to many of you for all of the work that has proceeded so very well. And before I hand over and back to you, Aliyah, 2 more things. One is that, as you know, Julia has been not so well, but she has been sending a message that she is recovering, and she's greeting everybody. And then I would like to ask Ministry of Health Nigeria and Nairobi whether you would like to have the floor before I hand back over to Aliyah for the final closing. So then I'll hand back over to you, Aliyah.
Thank you very much, Prof. Thank you everyone for joining this meeting. As usual, we'll send the recording later this week. I wish you a wonderful week and see you next Tuesday as usual. Thank you and bye again.
Thank you all. Thank you, Aliyah.